We are back with Dr. Theodore Manny, a urologist in the Triad and a member of the Cone Health medical and dental staff. And we're talking about the danger, the diagnosis, and the treatment for prostate cancer as the news broke over the weekend about the former president being diagnosed with prostate cancer. We talked a lot about how do they screen and things of that nature. How about we get to the point where we're living life right? How do we keep ourselves from getting that kind of diagnosis, or what kinds of things can we do to give ourselves a better opportunity for that?
Absolutely. Unlike things like lung cancer where smoking has a high association, prostate cancer is one that actually is not as dependent on lifestyle changes as other ones. But that being said, there are some things that definitely help. Maintaining a lean body weight certainly helps. When we carry excess weight, that does increase our risk of several cancers, and prostate is certainly one of them. Another is just being careful about hormone supplementation. There are some hormone supplementations out there that, if not really managed well, that can increase our risk of cancer significantly of the prostate. So just really best to be managed by a reputable provider.
Gotcha, yeah, because you hear ads all the time about all kinds of like male hormones and things of that nature. Make sure you're talking to your doctor about whatever
Correct.
You're taking. Okay.
Correct.
Let's talk about some of the treatment options for those who are diagnosed with prostate cancer and how the treatments kind of differ based on the stage or age of the patient.
Absolutely. Getting back to what we were talking before, stage 1 and stage 2 cancers, the ones that are isolated to the prostate, incredibly curable with surgery or radiation. For ones that are still more aggressive. For cancers that have gone beyond that have spread other places, like in the case of our former president, things like surgery and radiation really don't make much sense because they really don't offer cure. But there are some therapies that offer a significant benefit. We're actually in a pretty fortunate era where there's been an explosion in new therapies for men like this. Medicines that work on blocking the signals that tell the cancer to grow, medicines that actually attack the cancer directly. There are many options that work incredibly well that actually have very few side effects, and men can go on living a very normal, productive life for decades, even with prostate cancer that has spread other places.
Yeah, I'm glad you hit the side effects, because that was going to be the next question of, I'm glad we have new drugs, but what do they do to you? Because that is always the question. There is a certain kind of treatment, it's called active surveillance. Can you talk about what that is and what the pros and cons of active surveillance are?
Absolutely. Active surveillance is kind of at the other end of the spectrum from where we were talking about. Active surveillance basically is for men who have a very, very small or very, very non-aggressive prostate cancer, one that has a very low likelihood of spreading or causing problems. In that situation, we try to find a balance of not over-treating a man or subjecting them to surgery or radiation that can have side effects. And so with surveillance, we make a conscious decision just to monitor the cancer. And we use tools such as blood work and imaging and even repeat biopsies to make sure that the cancer is not changing. And if it stays small and stable, we decide to live with it instead of fight it.
All right, so we're talking to all of the men out there, but we're really talking to all of the people, the women out there who love their brothers, their dads, their spouses, their grandparents, whatever. So how should we kind of like help that? Like as in, do we need to tell them they just need to go to their general practitioner once a year, or do they need to go to a specialist? What do we need to make sure that they're doing?
Great. The main thing is just making sure that we have that good primary care doctor that we're going to. Especially for us men, 40 and over, we need to be getting that annual check. And we're the worst about it. Women are a little bit more fortunate in that most of them are used to seeing their gynecologist regularly and having that more ongoing care, even from their teens, 20s on. Men tend to have these gaps in healthcare where we don't see practitioners kind of from our pediatrician until we're older men. And so it is important for us to start seeing a good primary care physician or nurse practitioner, PA, when we're about age 40. And for those of us who are not men, but have somebody that is in our life, encourage that fella to go ahead and get established.
Yeah, thank you so much for your time and expertise, especially since it was so timely after this weekend. We appreciate it.
No problem. Thanks for having us.
All right, so if you need to send this to someone, need to show this to someone, this is going to be in the To Your Wellbeing section of our website. We'll be right back.